So Sandra and Michelle, if you want to bring up your slides. So Sandra Hoy is an assistant professor of social work at Laurentian University in Sudbury, Ontario. Dr. Hoy's teaching and scholarship is grounded in social justice, community development, and advancing the ethical aspirations of social work practice. For the past 20 years, her research program has involved community-based partnerships with health, education, and social care organizations engaged in service delivery, innovation, and localized social change efforts. Sandy has been in a research partnership with the Breastfeeding Buddies program since 2014. She's the mother of 2 breastfed children and is a former service user of Breastfeeding Buddies. Michelle Buckner is the mother of 3 breastfed children, holds a degree in social work, and was a Leche League leader for 15 years, and currently coordinates the expanding Breastfeeding Buddies program in Waterloo region. Michelle has been supporting families for over 20 years, has spoken at conferences across Canada on the topic of inclusive peer breastfeeding programs, systems barriers to nursing information, and engaging community partners in a collaborative peer-led model of support. Michelle received the Ontario Elementary Teachers Federation Women Working in Social Activism Award and the Laurier University Social Inclusion Award for her work with parents and children who face barriers to healthcare and breastfeeding and chest feeding support. Michelle's the co-author of several provincial Health Nexus peer breastfeeding training courses, is a BFI WHO Level 1 facilitator, and a past member of the RNAO Breastfeeding Advisory Panel, and recently a co-contributor for the UNICEF Breastfeeding Counseling Compendium. So we are so lucky to have you both here. I'm sorry we went a few minutes into your time. I know some of us will probably be able to stay a bit longer, but we also want to be respectful if you need to leave. So I will hand it right over to you.
Thanks, Megan. I think it's a nice bridge from your previous conversation about interdisciplinary work and working with kind of marginalized people, because that's kind of our wheelhouse. Michelle and I were social workers, community organizers, and really I think the Breastfeeding Buddy story is about that, of what community organizing and social work can contribute to breastfeeding support. And so today we wanted to share the story of the Breastfeeding Buddies program, but also our partnership. And is this the video, Michelle? Is it ready? Okay, so we thought we'd start with Michelle's bio there, said a little bit about some work we did writing up a case study for the UNICEF Global Breastfeeding Collective, Megan, that you mentioned earlier as well. And as part of that release, they wanted us to create a little video about the program, so we thought we'd share it as just 2 minutes. So.
Breastfeeding Buddies is a community-based peer support program that has been active in Waterloo Region, Ontario since 2001. Breastfeeding Buddies aims to assist families to meet their breastfeeding goals through feeling connected and supported in their community. With a population of about 617,000, Waterloo Region includes 3 fast-growing urban cities and is surrounded by rural communities. Canada has a universal, publicly funded health system, and the Breastfeeding Buddies program is located within a not-for-profit community health center. In Ontario, families want to breastfeed. Over 91% of mothers initiate breastfeeding in the hospital, but exclusivity and duration rates drop steadily over time, with only 33% of babies receiving exclusive breast milk at 6 months. Breastfeeding Buddies is a large peer support program with 147 volunteers. To become a buddy, a mother must breastfeed for at least 6 months and complete the program's 18-hour World Health Organization peer-based training. Buddies facilitate prenatal breastfeeding courses, and families can be matched by text, phone, or in person before or after their baby is born. The Breastfeeding Buddies community model relies on partnerships to connect with families facing barriers, such as young mothers, refugees, and parents using substances. In our view, breastfeeding rates are indicators of a community's success or failure in supporting families, not the individual failings of mothers. We offer strength-based, non-judgmental education and advocacy that aims to boost personal self-efficacy and informed decision-making. To grow and sustain a robust volunteer program, we have learned that developing mother-friendly volunteer opportunities that are flexible and include funding for childcare, food, and transportation is very important. We have also learned that building a culture of mutual respect between peer support and community-based leadership means more inclusive support. By using an evidence-informed model of training, peer breastfeeding volunteers are seen as capable and as credible sources of breastfeeding support. As a community leader in normalizing breastfeeding, the Breastfeeding Buddies program works within systems to make change and strongly believes peer breastfeeding support is essential in helping families reach their breastfeeding goals and ultimately creating a healthy, vibrant breastfeeding culture.
Well, that's a quick overview of what high-level view of what we're about, and kind of all the different resources that and social media stuff that Michelle's group is up to. It's kind of interspersed in that video as well. Quickly today, I wanted to just also loop myself in here and where I come to be within Breastfeeding Buddies. And as you mentioned, Meg, in my bio, that I was a former client. I was with my firstborn. We don't have a slide on that, Michelle. I'm just going to mention it. Yeah, we moved our slides around a bit, but so in 2010, I became a mother for the first time, and I really had no breastfeeding experience or had never even seen a breastfeeding baby. And that's actually a very common report that we get from participants in Breastfeeding Buddies workshops. Of one of the things that people do in the workshop is a peer-led workshop, and they get to see a peer who is breastfeeding their baby, and will, as part of it, they will show, come around, come look, watch this. And when we hear reports of impactful like what the participants report is impactful in the workshops, that is one of the things, along with all of the knowledge that they're gaining, just seeing a baby breastfed up close, you know, and here we're doing that with pregnant, usually very pregnant mothers and their partners or support people. That stuck with me here 12 years later. I still remember, and actually she was in some of the slides there, one of the peers that I had with me. And that was where I started with breastfeeding personally. And when I was pregnant with my second baby, I connected with Michelle and I said, this has really been transformative for me as a mother. And I was really interested in doing some community-based research with Michelle. So we talked about how the program had never really done anything beyond the required public health kind of surveys. And we wanted to do what Janet wanted to know, which was do some qualitative research around how is this thing working? How is it feeling for volunteers? What is it about? What's the kind of magic here that's happening? Because we can feel it and see it, but we wanted to collect that information. So part of that was we applied for a funding to do a qualitative look, arts-based approach, and kind of explore what's going on in the program. So that involved, one of the outcomes of that was our documentary that we put together with, and you can watch it in little short clips, but also it's a full hour of the story of Breastfeeding Buddies, and it's really talking to buddies themselves about it. And we learned a lot about the program through those conversations that we filmed as well. And some of that film is also in that previous video. It's called Weaving Our Common Threads. Go on, Michelle. We also did, what we really found from those interviews and focus groups going back to 2015 was that there's something about the building of a community in this program, and that was really important, that it was people that were connecting with other people and feeling they were part of something bigger than themselves. We found that the leadership and personal development of buddies was really key to the success of the program. And by success, I mean that we had a group of committed people that was growing, and some people that had been around for many years that were still reaching back and helping people learn to breastfeed and supporting women breastfeeding. And we found that the program reached beyond formal participants. So, for example, I saw the one clip that reminded me in that documentary of a woman who talked about her home community, which was in South America, that she was using her knowledge from Breastfeeding Buddies and her training to talk to friends of friends in South America about helping them with their breastfeeding. And just the idea that there's this network that the buddies have created in the last 20 years that is enduring and going beyond the borders of Waterloo region and beyond the borders of Canada. Michelle, thanks. And what we also heard when we talked to service users, so at that time we talked to a sample of about 25 service users. We followed up 6 weeks post-birth. So we asked people that were in the workshops if we could follow up with them after they had their babies to see what kind of stuck with them. And what we did hear from people was that they had a lot of information, and that Breastfeeding Buddies was really helping them put information into knowledge. And that's what I used to use, that it used to end there in that slide, knowledge, kind of helping work with information, putting into knowledge that they could use in their lives. And I would say this insight and wisdom piece is what we saw this year in our research that we did with Breastfeeding Buddies themselves. The volunteers, we did pretty extensive qualitative research study this past year. And what we saw from that was really the insights and the wisdom of years of supporting other women in breastfeeding. So I think all of this qualitative information, like I could talk a long time, but we have a short time, but lots of great data that we've collected over the last couple of years. So, but our most significant learning back in that kind of project that we ran from 2015 to about 2016 is that we need to be more active in support and outreach to moms. So from those interviews that we spoke to moms after birth that had been through the program or were currently in the program still, we found a lot of moms were struggling, and this is probably not news to anybody, but things were devolving for some people. Like they had a lot of supplementation going on. I'm not sure about a lot of things that were going on at the breast, and they didn't know where to go to. And it turned out some of our research interviews, thankfully myself and the other researcher, were former breastfeeding mothers, and we were doing peer support in these research interviews. Like I met with one woman at a coffee shop. She said that was the first time her mother-in-law let her out of the house, and she was struggling with cluster feeding and she didn't know if she could do it. And I was not expecting us to be an intervention in our qualitative, but we were. And we started to see that moms that had declined matches for buddies were actually asking for us for buddy support when we were the researchers. And so we started from that study, we really found like, how do we do better outreach to moms that are reporting they don't want to match with a buddy in the workshop, but clearly they didn't know what they didn't know, and were maybe on the road to having problems with breastfeeding. So Michelle really integrated that into how Breastfeeding Buddies did their matches going forward from that point. Thanks, Michelle. And really, after the end of that few years, we thought we need to be reaching more moms. Like we could see that there was a diversity of needs out there, and there was all this partnership building that was happening, but we really didn't have the capacity, the program to meet all the needs that were being asked of them. We needed to do more, we saw, and that's what we heard from mothers. We were really interested in doing more preconception. Megan and I originally reached out to you about this, about our idea around breast ed and doing more preconception research related to breastfeeding. And that really came from our work doing, partnering with the university, all our research team members being young women and young men, young people that were interested in breastfeeding and feeling like they'd learned all of this through the project. So we thought we need to do more of that. So that we had this idea to expand, Michelle. And we applied to 2 large funding proposals that, and they were failed. One, and really negative feedback from a few people. And we kind of were triggering emotional, I think, reactions related to breastfeeding in some of our reviewers, which was kind of interesting. And I bring that up because when we ended up succeeding with the Lyle Hallman Foundation, it really was kind of a chance meeting of one of the Lyle Hallman Foundation members at an event we were hosting for Dr. Newman from Toronto. I don't know if you're familiar with him, but Jack Newman came in and did a speak for healthcare providers at our university where I used to be at, Laurier in Waterloo. And it turns out he had really saved the breastfeeding relationship for one of the people at the Lyle Hallman Foundation when she was a breastfeeding mother, and she was really interested in our program, and now we applied and we were able to get $800,000 over 4 years to scale up the work of the Breastfeeding Buddies. And I bring that up because yes, we went through a competition, but it helps to have people in your corner. And that's what we've learned through this project as well, that, you know, breastfeeding parents will open up doors and do amazing things for others. And sometimes because of the negative emotions associated with, you know, struggling with breastfeeding, doors are closed for us. So that we've seen both in our work together. So I'll give it over to Michelle. Sorry, Michelle.
Oh, that's okay. So we're very excited to be sharing some of the stuff with you. These are the 4 pillars of the grant that we, Sandy and I, wrote together. And some of the stuff has really been impacted by COVID. I'm sure that's not a big surprise to any of you either. But we are really excited about what we've been able to accomplish. So one of the things that I wanted to share with you ahead of time is that our program is really about peer support. The grant did allow myself to go full time, and then I've been able to hire 3 other staff on our team, but it's really about our peer volunteers. And so we work really closely with these individuals to make sure that their role is clearly understood. So we talk about scope. What is it to be trained? What is their role, the boundaries, the expectations? We base our program on a referral pathway. So we see our program as one of the team members in a person's care pathway to meeting their feeding goals. And so we want them to be able to get the medical interventions in lactation support that they require. But we also know that a lot of breastfeeding and chest feeding challenges sometimes have nothing to do with the medicine, but have everything to do with the confidence and the support. So we have really strong partnerships in Waterloo region and beyond in Ontario, where we know that our Breastfeeding Buddy trained volunteers sit at collaborative tables, they host Breastfeeding Buddy training sessions, and most importantly, those partnerships are what close the loop on good continuity of care for breastfeeding help. So a medical doctor that's aware of us will refer to us, and likewise the other way around. As soon as one of our peers recognizes that a parent might be struggling beyond their scope, they make those referrals right away. So we always work from a place of best practice guidelines. All of our documents are evidence informed, and we really emphasize the informed decision-making model and strength-based support. This is an example of the resource that's been created by Breastfeeding Buddies for Waterloo Region. We really quickly responded to COVID-19, recognizing that a lot of the services for families were just simply not happening. We all shut down. Where do I go? Babies are still being born. And so this is on our website, and this is a very overview of everything and anything you can get in terms of lactation support. So this resource is updated by one of my staff regularly, and it's used all over. And it's a really great way for us to make connections with those service providers as well. So basically, the role of our peers are to normalize breastfeeding and chest feeding. They're there to share their lived experiences, to provide empathy, support, evidence-informed resources to parents in a non-judgmental way. And they receive training on all of those things. So Sandy had mentioned already, and a few of you have talked about the social determinants of health. That's a really important component for me for our program. And so this is a quote that came from a document through Best Start. Some of you have alluded to this, but we know that the people that are breastfeeding or chest feeding, giving their babies human milk, a lot of them are white educated families. And we know that our parenting youth, our Indigenous communities, our families from other countries, BIPOC community have lower breastfeeding rates. And that really, this comes down to breast milk inequity. It's a social injustice, and there's barriers that are in place that are very real. So when we talked about human milk inequity, we really came to the conclusion that one of the most effective ways to reach families that have lower breastfeeding rates is through peer support. I've worked in child protection in the past, and I can tell you that I know that families weren't telling me what was really going on. I can tell you that breastfeeding families often do not tell their public health nurse exactly what they're doing, but who they do tell that they're sleeping with their babies is their peer mentor. And so we know that getting to these communities, peers can be that link. So we recruit our peers from very diverse backgrounds, ethnicities, and ages. Right now, I have a 19-year-old breastfeeding buddy who gave birth about 3 years ago. She was very young, and I have a 60-year-old breastfeeding buddy. They have to have a minimum of 6 months breastfeeding or chest feeding experience. And currently we have 16 different languages represented in our program. So we want to meet parents where they're at, and I can't imagine learning how to breastfeed and not being able to communicate in the language that I feel the most comfortable in. So this is a huge offering that we have. All of our buddies, like in the video said, they are well trained, and they are advocates for just normalizing breastfeeding and chest feeding. So when Sandy and I talked about this presentation, really what speaks louder than anything are the stories that I'd like to share with you. So we've given you an indicator of a systemic barrier of somebody not being able to meet their goals and somebody that has, and that was with our involvement. So Josie's story is one that is a really hard story for breastfeeding buddies. Josie was referred to us from a social worker at the hospital. We have a pump loaning program here, and she was referred to us. She was a young racialized mom. She had given birth at a local hotel, and she had had a past with some drug use. And so at some point they cleared her to give the breast milk to the baby. She came to us several times for help. We provided the pump. But the baby was not in her custody. It was in her partner's custody, who then she also disclosed to us that she was being trafficked by, and that she did not feel safe. Josie didn't have access to her own housing, her own ID, resources, food, and she had no power. Family Children's Services gave custody to the partner, and she really wanted to provide breast milk for this baby. The saddest part about this story is that when she went to get resources for herself, Ontario Works social assistance, the staff there strongly encouraged her to just apply for the formula allowance that she could receive through government assistance. Subsequently, she stopped breastfeeding. She was getting messages from every person that was in her journey that breastfeeding wasn't important, and to just kind of let it go. Your baby's not in your custody. Why are you working or trying so hard to do this? So that was really hard for us. There were so many steps in this journey where the system was the problem in Josie meeting her goals. And then we have Chantel's story. And Chantel, much like Josie, had a lot of barriers, a lot of social determinants of health impacted her own journey as a parent. And so she started off breastfeeding right away, and then she got sick and she needed gallbladder surgery. And the minute she left the home, she was quite young. The grandmother took over and started giving the baby formula. And when she had the emergency surgery, she didn't know how to keep up her milk. Nobody in the hospital offered her a pump. She asked for help. And then when she came to see her nurse practitioner, they said, don't worry about it. Your baby is healthy. They're getting food. And so again, her choice to breastfeed was taken away from her. But nobody else also shared with her how much formula would cost. And where was she going to get that money from? And the fact that she wanted to breastfeed. Chantel didn't speak English as her first language. And she was extremely sad about not breastfeeding. Her baby was in her custody. She came to visit us a few times, and all that this individual needed was the confidence to say, your body is making milk. She was leaking milk as we were talking to her. And we can support you in building your milk supply if you want to make sure that your baby is back at the breast. And she said, that is my goal. Why has nobody else supported me? Why have every single person that I've talked to so far never offered that as an option? Because they made assumptions about her. She was young, she didn't speak English fluently, and honestly, they really judged her for being a single parent. So Chantel, the best part about Chantel's story is that was 3 years ago, and Chantel has trained as a peer breastfeeding buddy, and she visits our housing unit that's for young and youth parents. They listen to her way more than they would ever listen to me. So the only other thing that I really wanted, I know the time is ticking away. I know everybody really had to pivot with COVID, but one of the things that we learned with COVID, the silver lining, was virtual programming. We actually attracted a lot of different populations that we had never anticipated. It really decreased some barriers for some families. And so we created 10 virtual learning labs that are free. And then the other thing that's happened is now it's no longer dictated by geography. We have people attending our programs from all over the world on a regular basis. And so that's been very exciting for us. And during the pandemic, we also managed to train volunteers. And we've recently hired a new Arabic speaking peer worker. She can't keep up with the demand. And it's been really exciting to see that work develop, and her role as a peer supporter change breastfeeding rates in the Arabic speaking population in Waterloo region. So our pumping program is very busy. We originally got funding. Sorry. We originally got the pumps from the Pump for Preemie program that stopped across Canada, and now that's a partnership that's really been meaningful with the hospital. We get a lot of referrals. So these are just some of our social media posts. We run a free Me Breastfeed workshop. It's a prenatal lactation workshop. It's run by peers that are trained in group facilitation, and these classes are free, and they are 2.5 hours long, and we really have been shocked at how many people come to them that aren't from Waterloo region. Our coping with crying is just one of the many topics in our Latch and Learns. They happen every Tuesday and Thursday morning, and young parents that maybe don't see themselves in early on programming, parents that find it hard to get out of the house with a newborn baby, come to these programs very readily. And so we've seen a lot of uptake in that. So much so that we started a new session called Beyond Basics for older babies. So we cover all different kinds of topics there. And then Craving Connection. One is happening right now at a local market. Since we've been allowed to see people again, we've been really cognizant of how many families gave birth during COVID that literally never left the house, that their babies never met other people other than themselves unless it was on a screen. And so this Craving Connection has been a popular component as well. So our university partnership has been great. It's allowed us access to things that we never would have been able to do. So one of the things that sadly ended with the pandemic, but we were doing great research and evaluation on, was we were doing peer bedside breastfeeding support at a local hospital. It was extremely well utilized. It was an amazing partnership, and we're hoping to get back in there, but it did end with COVID. So that is one area of our partnership that we're really hoping to ramp back up again. And our UNICEF case study has been really important, and it's something that we're proud of, but we're hoping to expand on. So Sandy, I think the other last few are yours.
I just shared some quotes from the most recent Breastfeeding Buddy study. Person says, like I do other volunteer stuff in the community, and I would just like to say that part of Breastfeeding Buddies for me is probably the most satisfying volunteer role I've ever done, because you are meeting women in the moment when they need help, right? And our study goes into much more detail about what this help looks like, but just get a sense of the meaning that buddies have received from their experiences. This person, one more quote, and she says, and she's overcome everything, the inverted nipple, the C-section, and she's never given a drop of formula, and she's a single mom. And I just feel so proud of that all the time. And sometimes I text her, I'm so proud of her. I feel like a geek texting her how much I'm proud of her all the time. But I'm sure she feels love from me. And I'm sure it's encouraging to hear that someone is proud of you. I think that quote kind of pulls the love and care that is embedded in the program. I think this was our last slide. What have we learned? This is just from our case study that we talk about. What have we learned? That there's power in investing in community of volunteers with lived experience. Evidence-informed practice is important. Leadership matters. Community partnerships are so important to this project, and the university is just one, but all of the other partnerships. We don't think a success full program could be replicated within a bureaucratic, risk-averse environment. We don't think these, we've seen experiences in Ontario when they try to start up peer support in public health units, they fizzle. We haven't seen much success when they're run by folks that don't really have a community development aim. That's our theory based on practice. And that we think, you know, that this kind of model has something to offer communities, especially the diversity of mothering experiences that we encounter. So I think that was a quick version of it all. Yeah.
Thank you so much, Sandy and Michelle.